I'm excited to share a little bit more about our opportunities in healthcare. So, we'll start by discussing burnout in terms of causes, signs, and prevention, both personally and professionally. And then we'll transition into how channels, roles, and technology are combating burnout and providing access to opportunities in healthcare. So, burnout is physical, emotional, or mental exhaustion accompanied by decreased motivation, lowered performance, and negative attitudes towards oneself and others. And typically, many individuals don't even realize they've reached burnout until they've become extremely overwhelmed by exhaustion. And then some of the common causes can be consistent high volumes of work, everyday stressors such as health concerns, financial instability, exams, classes, your overall workload, short windows to complete tasks, and then, of course, work-life balance. And then these are some signs of burnout. So those can include fatigue, changes in sleep and eating patterns, also mood changes such as anger and irritability. And then individuals can also face physical symptoms such as headaches and GI upset. And then some great ways to combat burnout personally are you could find a hobby and get active. I love going on long walks. Those are always super refreshing for me with my pup. You can set a routine and make sure you're building in breaks and time for you. And then also setting boundaries and accepting help when needed. So at Health Channels, we're also working to combat burnout. So Health Channels represents one unified vision delivered through multiple brands. And with more than 20 years of experience and over 30 million point of care encounters, and a workforce of more than 100,000 professionals across all 50 states, we are committed to developing the next generation of healthcare leaders. And then, formerly known primarily as Scribe America, our organization has expanded under the Health Channels family of brands. And today we offer 4 specialized brands. So those are Enably Health, Scribe America, Speak AI, and Healthcare U. And this expanded portfolio strengthens our ability to partner with healthcare organizations by delivering deeper innovation, addressing workforce challenges, reducing burnout, improving financial sustainability, and providing seamless technology integrations. So first we'll dig into our clinical assistant position with Enably Health. So clinical assistants play a dual role in supporting patient care by assisting providers with both clinical tasks and medical documentation. And this position ensures efficient patient flow, accurate charting, and high quality patient experiences. The key responsibilities of clinical assistants consist of clinical support duties such as preparing exam rooms and ensuring supplies are stocked, escorting patients to exam rooms, taking and recording patient vital signs and medical history, handling patient education, explaining procedures and follow-up care instructions, and then supporting coordination of referrals and follow-up appointments. And then, depending on the facility individuals are hired to work for, clinical assistants can also be required to complete documentation support, similar to our medical scribe positions. And this can consist of documenting patient-provider interactions and ensuring that you're maintaining an accurate electronic medical record. So then I do have some graphics on the screen. So this graphic shows that 48% of respondents met the criteria for burnout, and many of those sites also reported understaffed teams. So Enably Health aims to bridge the gap by providing clinical and administrative support. And then as you can see with Enably Health MAs, there is a significant increase in patient tasks completed per day. And MAs are proven to provide and improve the workflow of the providers that they partner with. And then Health Channels is not only supporting healthcare through clinical assistance, but also through our medical scribe positions. So the role of a medical scribe has evolved from simply assisting with documentation to becoming a productivity partner for healthcare professionals. By reducing the clerical burden associated with electronic medical records, medical scribes have helped improve the efficiency of entire care teams. As burnout becomes increasingly common, scribes support clerical tasks allowing healthcare providers to work at the top of their licenses. So, Scribe America's team has partnered with healthcare providers for nearly 2 decades to enhance patient care delivery, reduce administrative workload, and improve care team workflow and accuracy. And then some key benefits can include increasing provider satisfaction by reducing time spent on chart updates, gathering essential information to support the providers, streamline compliance and coding, and then overall reduce provider burnout. So then from my experiences working in the emergency department, I know going out of the way to support the providers was greatly appreciated them. And getting to know the healthcare team has provided opportunities and unique experiences to grow, learn, connect, and impact the healthcare field. And then medical scribes are decreasing provider documentation time by 66% and have increased provider satisfaction by 43%. Through roughly 100,000 weekly medical scribe assisted encounters, medical scribes allow the providers to spend more time interacting with their patients. And then Scribe America also provides early access into healthcare. So we recently secured the Handshake Early Talent Award for the 4th year in a row. And this is a testament to our team's unwavering dedication to the next generation. So we don't just offer jobs, we offer a pathway into medicine, and the recognition validates our mission to empower students and recent grads with the tools, mentorship, and hands-on experiences that they need to be successful in the evolving healthcare landscapes. And then this is just one of many ways we connect with the next generation of healthcare leaders. And I, for one, am excited to continue to adopt our technology advances. And then this is one of our other opportunities that we have at Health Channels. So we also have Speak AI, and this is our commitment to technological innovation. So these are healthcare grade AI that capture real-time clinical conversations. And then Speak AI creates an accurate clinical charts. They also provide deeper EHR integrations and then secure and compliant HIPAA compliancy. And then you can also create customized templates and preferences. So these can be very specific to provider and specialty. And then you also get guided implementation and support and two-way feedback loops with clinical support specialists. So this is another way we're integrating technology into the healthcare field to help reduce that provider burnout and day-to-day tasks. And then in return, improving those relationships and the evaluation of patients. And then with the advancements in veterinary technology, the life expectancy of our furry friends has gone up over 200%. And this is definitely a positive advancement, but has definitely increased workload for veterinary workers. The 2023 Merrick Animal Health Wellbeing Survey reported that burnout levels vary between roles, with 87% of staff overall reporting medium to very high levels of burnout. Speak AI has helped with this understaffed facilities to take notes in real time so that the providers, vets can focus on what really matters, as Speak AI has helped to reduce documentation time by 50%. And then in addition to reduced documentation times, providers are also able to accurately capture clinical conversations in 20+ languages, which lends to improved documentation and continuation of care for individuals with different language barriers. So then at this time, I'd like to thank you all so much for joining the presentation and learning a little bit more about Health Channels and our brands, digging into burnout and the impact that we have with facing burnout, and then technology advancements and integrations, and then also providing access for individuals to step into the healthcare role and work at the top of their licenses. I do have up on the screen my contact information. Please feel free to connect and reach out. I also have a QR code where you can fill out some information and we'll send you some details. But then at this time, I would like to open up the floor if there's any questions, call outs, and I'd be happy to dig into those with you all.
Beth, hey.
Yeah,
Great.
hey.
Hey, one of the career coaches for the healthcare science research community. Thanks so much for being here and for talking us through this important topic. Just a quick question for you in terms of our students potentially finding opportunity with your organization. Can you
Yeah.
talk a little bit about what roles that you might have available and what you might look for in potential candidates?
Yeah, definitely. So we have our medical scribe and our clinical assistant positions, which I touched on their responsibilities a little bit during the presentation. But specifically for these positions, we don't require any prior healthcare experiences or certifications, as we do offer a paid training for all new hires. So this training is broken down into three parts. The first is essentially a crash course in medicine. And then from there, you move into bridge training to help gap the bridge between the training portion and then the on-site portion. And then the final piece is on-site, where you're actually starting to work with the medical scribe and provider or the clinical assistant and provider and starting to build on those roles and responsibilities. So that's the first part, but then definitely looking at some of those other things we look for: individuals that work well with others in a fast-paced environment, those who are eager to learn, definitely individuals that have an interest in healthcare. We also seek individuals that have a minimum typing speed of 40 words per minute, specifically for our medical scribe positions. That is not a requirement for our clinical assistant positions. And then, as I already dug into, we don't have those prior healthcare experience requirements. So I always recommend, if you can highlight some of those other pieces I just touched on in the application, that's a great way to stand out. The example I always give is a server. You might not think that's related, but as a server, you're working with a variety of individuals. There's typically timelines you need to meet. Customers need to be happy, warm food. So that's a great way to show that you can communicate, manage different tasks, work with different individuals. So I would definitely focus on those. And then for our positions, our medical scribe, we do have both remote and in-person positions. And then with our clinical assistant, those are typically in person, but you are assigned to work at a healthcare facility. That can be an emergency department, an inpatient facility, or an outpatient site. And we do offer both full-time and part-time opportunities. So there is that flexibility as well. And then for students, uh, they typically will work in emergency departments and we're inpatient facilities, as those provide the most flexibility as they're staffed 24/7.
Awesome. Thank you.
Yeah, of
There's
course.
a question in the chat from Cecilia. She asked if we can, or if students can email their resume directly to you, and also what would make their resume stand out during the hiring process.
Yeah, so you are more than welcome to send your resume over to me. I will say, specifically for our application, we actually do not require a resume. So the things I would focus on for standing out would be looking at the first part of the application: availability, making sure you can meet our minimum requirements for availability. So it is 2 shifts per week, and shifts typically range from 8 to 12 hours long, but I will say students typically work the eights. So make sure you can showcase that on your application. From there, a strong typing speed is definitely great for the medical scribe position. So you can use websites like 10 Fast Fingers or typing.com to practice your typing speed prior to actually completing that on the application. While we do require 40 words per minute as our minimum, definitely if you can type quicker, that is not a problem. And then for that last part, it is the interview. And this is where I would say that piece ties in the most with your resume to help stand out. So when completing the interview, you'll want to highlight some of those pieces we already discussed. So it works well with others in a fast-paced environment, eager to learn, strong written and verbal communication, attention to detail. If you can showcase those pieces in the interview, I definitely would recommend doing so. And then I also always recommend going to the career site and kind of looking at our mission values, making sure they align with you. And then also, definitely not word for word giving it back. But if you have personal experiences or similar values, making sure you highlight those as well to show that you've researched the company and would be a good fit. So those would be the things I would definitely focus on for that application portion.
Thank you, Beth.
Yeah,
Thank
Um,
you.
Go
I had
ahead,
a
Rachel.
question over
yeah.
here. Hi. So what sort of career growth opportunities do you offer, like beyond these? Like if I were to join, what is the career growth looking like?
Yeah, so there's definitely a few pathways we think of. So the first is if you are definitely clinical focused, you can work as a medical scribe. And then from there, we do have site managers. We call them chief scribes. So you could become a chief scribe and manage your site. We also have trainers. So you can on site help train up the new medical scribes or clinical assistants. And then staying in the realm of clinical, you can also become a traveler. So you can help travel to different sites in the US if they are understaffed or we have a new program opening up, you can help get those off the ground. So those are all of our, I would say, growth in terms of clinical. From there, you can definitely continue to grow. A fun fact, all of our operations team, minus one person, was actually a medical scribe. I myself was a medical scribe. I was then a trainer. I then did hiring, and now I am our talent acquisition manager. So there's also opportunities to grow then into the corporate side where it's still all healthcare related, but there are shifts if you're okay with moving away from that clinical piece. In terms of growth, though, as well, this wouldn't specifically be with us. But when I was a scribe, almost all of the nurses, NPs, healthcare administration, and then some of our residents that I worked with were all actually medical scribes at my site. Once they finished their degree, certifications, whatever they were seeking, they were then hired by the facility because they already had those connections and the individuals knew their work ethic. So it was a great way for them to then get back into the field at a place that they had previously worked with a staff they knew well. So it's a great way for connections that way in terms of growth.
Oh, thank you very much.
Yeah, of course.
Beth, we
There's
have a
a,
question in the chat.
oh,
The question is, for clinical assistant positions, do you provide training and do you need a license or certificate?
Yes, so we provide all of the training you need. Our training is broken down into three main parts. The first is virtual and is essentially a crash course in medicine. You also learn how to document, pertinent negatives, all of that. And then in that time, you'll also learn anything relevant to the clinical assistant position. So if that's learning how to take EKGs, vitals, sharing discharge information, follow-up care, that will all be taught and then from there, you move into our bridge training, which then is to build and bridge the gap between Scribe U is what we call our virtual portion, and then our clinical training. And then actually on site, you typically start by shadowing a scribe physician pair or a clinical assistant physician pair. Slowly tasks are added to your plate until at the end of that training, you are completing the responsibilities on your own. But during that time, depending on the facility, you'll have those additional training pieces. So if they need you to take EKGs, you'll be taught that. If they have specific HIPAA training or code training, you'll also take all of those pieces. So we provide everything you need, and you don't need any prior certifications or experiences.
We have another question in the chat, Beth. Do you recruit new grads who are just starting out as a scribe? Is it mandatory that they have experience?
Yeah, so we do. This position is open to pretty much anyone that is interested. We typically see the most interest from undergrad students, though, and those that are taking a gap year or recently graduated looking to get into the healthcare field. And then, no, there are no prior experiences or certifications. I do just recommend if you don't have those prior certifications, experiences, that you highlight your interest in healthcare or some of those pieces we discussed prior regarding the communication and eager to learn how you can tie that into your own experiences that you've previously had.
Beth, we have another really good question here. Student says, I'm interested in starting as a medical scribe, but I also come from a computer science background. Do you see opportunities for people in roles like that to eventually contribute to healthcare technology?
Definitely, yes. Especially with, I would say, the way things are evolving and changing with the technology integration into healthcare, most definitely. And I will say individuals that have then pivoted to other pieces, maybe not so much the clinical anymore, have been a valued asset to their team because they have those clinical experiences. They know what the day to day is on the floor, kind of the pain points for providers. So that way they can take that knowledge. And then, for example, with the technology piece, there's possibly something you could build out that someone else might have missed because they didn't have those clinical experiences. But you're like, I know this is a struggle, a pain point on the day to day. I can use my technology computer background to help fill that gap.
That makes sense. Thank you.
Yeah, of course.
We have another question in the chat. What does a typical shift look like for a clinical assistant or scribe, and what responsibilities do they handle on a daily basis?
Yeah, so there is some variability with the department. So for an outpatient setting, typically you know who's coming in that day. So for example, if it's a primary care provider, you know who has their appointment scheduled. You would start by prepping charts, getting the rooms ready if you're a clinical assistant, and then seeing the patients with the provider, actually going room to room and documenting everything that is occurring. If you are in an inpatient facility, it's also a little bit more structured. You typically know who's on the floor, but you may have new people coming in. So those charts you would have to do more on the fly. But then in the emergency department, you really don't know what's coming through the door. Documentation is completed much more in real time in the room, but you would still be going room to room with the provider, seeing patients, and it would vary. Could be a cardiac arrest to a cold. There is that variable piece there as well. And then with outpatient, it's typically more normal business hours, Monday through Friday. And then inpatient and emergency department are staffed 24/7. So there are also weekends, overnights, early mornings, afternoons, late evenings. So there is additional flexibility there. Shift times are typically 8 to 12 consecutive hours. It does vary based on site. But then the main piece of the documentation for the medical scribe is pulling the past medical history, creating the HPI, and then documenting the review of systems, transcribing the medical evaluation, the exam in the room, and then following up with documenting any pertinent timestamp, the medical decision making. So when lab work imaging was ordered, came back, if there were any consultations, those are all things you would document as well. And in often cases, if lab work is coming back and you see something reported as abnormal, you would call that out to the provider so they're aware, or let them know if an x-ray has already been read, what the team had seen, if there were any acute findings, calling out those things, and then transcribing the diagnoses, discharge, any follow-up care as well. So those are all of the documentation pieces for the medical scribe. With the clinical assistant, very similar. It does vary a little bit, again, based on specialty, facility, all those things we talked about prior. But in addition to that documentation, they would also be doing responsibilities like bringing the patient from the waiting room back to their room or transporting them to imaging. They would also be collecting those vital signs, EKGs, upon arrival or when needed. They would also, instead of just transcribing discharge, they would also be discussing it with the patient, what follow-up care would be, what was occurring. So that's the main difference with that piece, but that is the overall like day-to-day of those positions.
Beth, we have another question. What's the estimated time it would take to get the license that you were referring to in certifications?
Yeah, so again, it does vary a little bit based on location, depending on the requirements that they have. But typically, we say about a month for all of the onboarding and training pieces. And then we do have a 90-day evaluation period. So after your initial training and onboarding, you would have that afterwards, which does technically extend the training period. But during that time, you are filling the role on your own. You just have additional support, and individuals are reviewing charts more regularly just to ensure everything is up to standard.
Another question we have, Beth, is what is the estimated time you will get word of getting the position after applying?
Yeah, you should typically hear back within 72 hours from the hiring team from the time the application is complete. If for any reason you don't hear back in that time frame, you are always welcome to reach out to me via email, and I'm happy to connect with the hiring team. But it's a fairly quick turnaround time.
Thank you. Another question that I had, because we see so many, let's call it students interested in clinical health, and I know clinical health has a lot of definitions. um, and there are no internships for students on that path. And we have recommended they consider, the scribe position. So number one, it's refreshing to see also the clinical assistant piece. So when you say part-time, that is definitely a thing. So a student doesn't necessarily have to do this in their gap year. They could be accruing patient care hours, let's call it, while they're still going to school as an undergrad. Is that kind of what you're saying with giving that part-time feature?
Yes, definitely. So we have a ton of undergrad students that work in the position actually, and will do the part-time. They'll either, if they have the luxury of like building out their school schedule, sometimes they can fit it in during the day. But oftentimes they'll do overnights, evenings, weekends, the 8 hour, two minimum shifts per week to get that in while they're still in school. And then I always like to add, if you're a hands-on learner, I believe it makes a world of a difference. I was studying while working as a medical scribe, and it was like night and day making those connections. So while you have to understand you are taking on a little bit more of a load, there are definitely a ton of perks that come with it, and definitely possible to do both.
Thank you, Beth.
Yeah.
Awesome. Great. Well, thank you, Beth. We're coming up at the end of the time, so we're going to close it up right here. But reminder that Beth has shared her email right there, and she's willing to look over resumes. If you wanted to send that over to her, she has her LinkedIn, so make sure you connect with her. Thank you, everyone, for asking such great questions. We've recorded this session and we'll have it uploaded on our YouTube channel. And one more reminder before we close out, we do have another career meetup led by another employer this afternoon at 2:30 Beyond the Hospital, Exploring Careers in Home Health and Pediatric Care. So please join us for that. Beth, we really thank you so much. And make sure everyone connects with Beth. Thank you and have a great day.
Thank you.